So we're about to start our shift and get handoff from the nurse who is leaving her shift. This is where we learn about the patient we will be caring for and review the patient's medical record to gather any relevant information. We also want to anticipate any health concerns that the patient may have. We are meeting at the nurse's station outside of the patient's room.
Hi Amanda, you're going to be taking care of Mr. Chief today? Okay, so Mr. Chief is a Native American man with stage 4 colon cancer. He's very religious and thinks he can cure his illness by correcting his evil ways. And he's just come back from surgery for the placement of a colostomy. Being that he's religious, he had expressed some concerns before his surgery, so we thought it would be a good idea to bring in Mr. Kakata, who is a religious leader from Mr. Chief's tribe, in order to discuss any religious concerns or cultural differences we might encounter while he's here. So Mr. Chief's scenario is particularly interesting because his religious beliefs were inextricably linked with his health management and healthcare beliefs. I immediately recognized the need to bring in an expert of Mr. Chief's culture and religion in order to properly care for Mr. Chief.
For example, one thing you might want to note on is not to make direct eye contact with Mr. Chief, because that is often a sign of disrespect in the Native American culture.
Thank you for that information. Let's go see Mr. Chief.
So now we're about to go meet Mr. Chief for the first time. During this time, we will be closely observing his messages and behaviors and beginning to make inferences about them. We will also assess his overall health status, especially the pain status since he just had surgery. Hello, Mr. Chief. I'm Amanda. I'm going to be your nurse today, and this is Adrienne. She's the nurse in training.
Nice to meet you.
I'm just going to do a quick pain assessment, see how you're doing after your surgery on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt in your life.
I would say a 7, but I deserve every ounce of my pain.
Initially, I was concerned that Mr. Chief's pain was a 7 out of 10, and I wanted to immediately address that so he would be more comfortable and willing to talk about his procedure and how it was affecting him. However, he volunteered information so that we determined that the timing was right to address his spiritual concerns and make sure we could incorporate his cultural beliefs and values into his plan of care.
Tell us more about your cancer process.
Well, I've had a very dark past, and I feel like I need to pray to the gods to help correct my evil ways, and then I shall be healed.
Because he had a colostomy, in our culture, the belief is removing part of the body corresponds to removing spiritual path to ancestors.
During the working phase of the relationship, we want to encourage and help the patient express his feelings about his health. We also encourage his self-exploration. As the nurse, I must provide information for the patient to understand and modify his behavior accordingly.
Mr. Chief, would you mind us taking a seat to discuss your care?
Okay.
It must be hard feeling like a part of your spirit is missing.
Here we care for the patient in a holistic manner, meaning we don't just care for the physical body, but for the mind and spirit as well.
I do not feel like I could heal until my spirit is whole once again.
I can see the importance of healing your spirit before you begin healing your body. Tell me some ways in which you can heal your spirit.
Well, I normally turn to Mr. Kakata for my spiritual needs.
Traditional Indian medicine for cancer care typically includes herbal beverages, prayer, or topical ointments and ceremonies.
We can do our best to incorporate that into your care.
Since I am his daughter, I will be taking care of him. Could you better explain the procedure?
Yes, we took out a piece of your father's intestine that had the cancer cells and reattached the remaining part of the opening on his stomach.
And what do I do about the bag sticking out of him?
You just want to make sure you keep it clean and change the bag when full or replace it when necessary. And if there's any pain or redness at the opening, make sure you contact his physician.
In regard to food, should he stay away from anything?
No, not really. Just make sure he has lots of fiber and fluids.
And we'll make sure we print out more of these instructions and go over them again before discharge. I noticed that you were not using any medical terminology when explaining the procedure to Mr. Chief and his daughter. For example, you said opening instead of stoma. Why weren't you explaining in more detail? Wouldn't they want to know?
It's important to be aware of the vocabulary you use when communicating with patients. Most patients do not understand medical jargon, so we need to make sure we communicate with patients and their families in a way that allows them to understand and retain the information.
Okay, I'll make sure to limit my use of medical terminology to discussions with other healthcare providers. Don't worry, you're going to recover 100%. I know plenty of people who've been in your situation and been just fine. I'm sorry about your situation, though.
Well, Mr. Chief, the doctor says today is the day you'll be discharged home. Do you feel like we've met our goal of incorporating your spiritual beliefs into your care?
Yes. Thank you for bringing Mr. Kukata in to help discuss my spiritual concerns. Also, thank you for accommodating my ceremonies and herbal remedies in the hospital. The fact that you kept my spiritual concern a priority really showed that you cared. I feel like my spirit is once again on its way to being whole.
It makes me happy to hear you say that. I'm glad we were able to help. Well, we've gone over your discharge instructions. Did you or your daughter have any questions?
Not at this time.
Okay, well, please don't hesitate to contact myself or your physician if you have any questions or concerns.
Thank you.
Thank you.